In clinical studies, these 5 supplements lowered systolic blood pressure by up to 10 to 15 points. And number 1 is something over 50% of seniors are deficient in right now, without knowing it. Millions of seniors are taking blood pressure medication every single day, dealing with side effects, costs, and dependency, when natural compounds with real clinical backing could be making a meaningful difference alongside that treatment. I'm Dr. Mandy Thomas, and before anything else, I am not telling you to stop your medication. That conversation is between you and your doctor. What I am saying is that the science around natural blood pressure support has come a long way, and today we're counting down the top 5 supplements the research actually backs. Stay with me all the way through, because the stack strategy at the end tells you exactly where to start if you're a senior on medication right now. Drop a comment. Have you ever tried any natural supplements for blood pressure? Yes, no, or curious? I want to know where everyone's starting from. Here's why supplements can actually work for blood pressure, and why so many seniors are missing this. Your cardiovascular system is a deeply interconnected network of hormonal signals, mineral balance, and vascular biology. Most seniors with high blood pressure in the early to moderate range aren't dealing with catastrophic disease. They're dealing with deficiencies and accumulated lifestyle factors. That means there's real room for targeted nutritional support to make a genuine difference. Uncontrolled blood pressure is one of the leading causes of stroke and heart failure in seniors. The tragedy is that many people never realize they had options beyond simply taking another pill and hoping for the best. Let's count down. Number 5, potassium. Not glamorous, but foundational. And this is especially important if you're over 65, because the standard senior diet is often critically low in it. On screen, graphic. Average senior potassium intake versus recommended daily amount. Potassium and sodium have a push and pull relationship in your body. Sodium raises pressure by pulling water into your blood vessels. Potassium helps your kidneys flush that excess sodium out. When potassium is adequate, blood vessels relax more easily, directly reducing pressure. Multiple large-scale meta-analyses confirm meaningful reductions in both systolic and diastolic blood pressure from increased potassium. And the effect is even stronger for people eating a high-sodium Western diet, which describes most seniors. In practical terms, even a modest increase in potassium can produce a 4 to 5 point systolic reduction. That might sound small, but research shows that kind of consistent reduction significantly lowers stroke risk over time. The problem is, processed foods strip potassium out, and most seniors aren't eating enough vegetables, legumes, and whole foods to compensate. Targeted supplementation fills that gap. Important caveat: supplements are typically capped at lower doses because high potassium can affect heart rhythm. If you're on ACE inhibitors or potassium-sparing diuretics, talk to your doctor before supplementing. I've linked the exact formulation and dosage backed by clinical evidence in the description. Don't guess with this one. Number 4, vitamin D. Most seniors think of vitamin D as the bone vitamin. But something over 65 years old changes the picture significantly. Your skin becomes less efficient at producing vitamin D from sunlight, which means deficiency becomes far more common precisely when the cardiovascular stakes are highest. On screen, statistic: 40–80% of Western adults have insufficient vitamin D. Here's the blood pressure mechanism. Vitamin D suppresses renin, a key enzyme in the hormonal pathway that controls blood pressure through vessel constriction and fluid retention. When renin is overactive, it tightens blood vessels and drives pressure up. Adequate vitamin D keeps that cascade in check. Epidemiological data consistently shows higher rates of hypertension in vitamin D deficient adults, and clinical trials correcting deficiency show measurable blood pressure reductions, particularly in people who were most deficient to begin with. Ask your doctor for a 25-hydroxyvitamin D blood test. If you come back deficient, supplementing is a straightforward decision with benefits well beyond blood pressure. Look for vitamin D3, the most bioavailable form, ideally paired with vitamin K2 to direct calcium properly. I've linked the clinically relevant formulation below. Number 3. CoQ10. This one has some of the most specific research of anything on this list, and it's particularly important for a large group of seniors who have no idea they need it. On screen, statistic. Statins are among the most prescribed medications in seniors. CoQ10 lives inside your mitochondria, your cell's energy generators. Your blood vessel walls are lined with smooth muscle cells that need substantial energy to maintain proper tone and flexibility. CoQ10 deficiency makes them stiff and dysfunctional. It also reduces the antioxidant protection your endothelium, the inner lining of your vessels, depends on to stay healthy. Multiple randomized controlled trials and meta-analyses confirm that CoQ10 supplementation produces clinically significant systolic blood pressure reductions, typically in the range of 10 to 17 points in people with hypertension. Now, the group that really needs to hear this. If you're taking a statin for cholesterol, your CoQ10 levels are almost certainly being depleted. Statins inhibit an enzyme that's also responsible for producing CoQ10. This is one of the most underappreciated drug-nutrient interactions in senior health. When buying CoQ10, look for ubiquinol, the active reduced form. It's significantly better absorbed than ubiquinone, especially as we age. I've linked the exact formulation and dose range used in the clinical trials in the description. Now I want to pause here, because if this is giving you options you haven't fully considered, I want to make sure you keep getting this kind of information. Hit subscribe right now and turn on notifications. Every week, I break down the real science behind cardiovascular health specifically for seniors in plain language, and share this today with a senior you care about managing blood pressure. You might be giving them something genuinely useful. Now let's finish with the top 2, and these are the ones I want you to pay closest attention to. Number 2, fish oil, specifically EPA and DHA. Decades of cardiovascular research, an enormous evidence base, and for seniors specifically, this becomes even more important after 65 because arterial flexibility naturally decreases with age, and omega-3s directly address that. On screen, diagram. Omega-3 pathways affecting blood pressure. 3 mechanisms working simultaneously. First, omega-3s help blood vessel walls produce more nitric oxide, the molecular signal that tells vessels to relax and dilate. More nitric oxide means lower vascular resistance and lower pressure. Second, they have potent anti-inflammatory effects that reduce vascular stiffness and endothelial dysfunction. Third, they improve the physical flexibility of cell membranes, affecting how cells respond to blood pressure regulating signals. A large pooled analysis of randomized controlled trials found significant reductions in both systolic and diastolic readings, with the effect most pronounced in people who already had elevated blood pressure. In practical terms, consistent omega-3 supplementation has been associated with systolic reductions of 4 to 5 points in hypertensive adults. Combined with the anti-inflammatory effect on arterial walls, the long-term cardiovascular benefit is meaningful. Quality is critical in this category. Look for high EPA and DHA concentrations per serving, third-party testing for heavy metals, and minimal aftertaste, which is the sign of a well-processed product. Research suggests EPA may be more significant for cardiovascular outcomes specifically, so products heavier on EPA are worth prioritizing. Target at least 2 grams of combined EPA and DHA daily. I've linked the exact product I recommend for seniors in the description. Number 1, magnesium glycinate, strongest overall evidence, most widespread deficiency, multiple direct mechanisms. This is the one. On screen, statistic. Over 50% of seniors deficient in magnesium. I had a patient, a 71-year-old woman who had been managing blood pressure for 6 years. She was on 2 medications, eating reasonably well, exercising. Her readings were still running 148 to 152 systolic most mornings. We checked her magnesium. She was significantly deficient. We added magnesium glycinate at a therapeutic dose. Within 8 weeks, her morning readings had dropped consistently into the 135 to 138 range. Same medications, same diet. One addition. That's not anecdotal luck. That's the mechanism working. Here's why magnesium affects blood pressure so directly. First, it's a natural calcium channel blocker. That phrase should sound familiar. Calcium channel blockers are a major class of blood pressure medication. They prevent calcium from entering smooth muscle cells in vessel walls, allowing those vessels to relax. Magnesium does this naturally. When levels are adequate, your blood vessels physically relax. Second, magnesium supports nitric oxide production. Magnesium-dependent enzymes are involved in nitric oxide synthesis. Low magnesium means lower nitric oxide, which means vessels that can't relax properly. Third, magnesium powers the sodium-potassium pump, the molecular machine maintaining electrolyte balance across cell membranes. When this pump underperforms, cells accumulate too much sodium. Blood pressure rises. On screen. Chart. Meta-analysis results showing magnesium supplementation and BP reduction. Multiple meta-analyses of randomized controlled trials confirm statistically significant, clinically meaningful blood pressure reductions from magnesium supplementation, dose-dependent with the greatest effects in deficient individuals. Why glycinate specifically? Magnesium oxide, the most common cheap supplement form, has poor absorption. You may be taking a large dose and absorbing very little. Magnesium glycinate is bound to glycine, an amino acid with excellent bioavailability and virtually no digestive side effects. And glycine itself has calming, sleep-supporting properties, an additional benefit for seniors whose blood pressure is worsened by stress and disrupted sleep. Target 300 to 500 milligrams of elemental magnesium daily. Make sure you're reading elemental magnesium on the label, not the total compound weight, which will be a larger number. I've linked the exact formulation and dose in the description. It's the first link you'll see. Now, here's the stack strategy I promised, because these work even better together. If you're a senior managing blood pressure and you're on medication, start with magnesium glycinate and CoQ10. Magnesium addresses the most widespread deficiency directly. CoQ10 addresses the depletion most likely caused by any statin you're taking. Those two together, consistently, give you the fastest meaningful foundation. Add vitamin D3 with K2 next, particularly important if you haven't been tested recently or spend limited time outdoors. Then layer in potassium through food first, supplementation second, with your doctor's input given the interaction risk with certain medications. Fish oil builds on top of all of that, addressing the inflammatory and nitric oxide pathways the others don't fully cover. On screen, simple stack graphic. Magnesium, plus CoQ10 first, then vitamin D, potassium, fish oil. If you're addressing blood pressure holistically, magnesium and vitamin D together are also a natural pair, because magnesium is actually required for the enzymes that convert vitamin D into its active form. If you're deficient in magnesium, your vitamin D supplementation may not be working as well as it should. Before we close, none of this replaces medical guidance. If you have diagnosed hypertension, kidney disease, or you're on medications, speak with your doctor before adding any of these. Potassium can be dangerous at high levels for certain people. Magnesium needs to be cleared by anyone with kidney issues. Fish oil at high doses can affect bleeding time. These are real considerations. Personalized guidance matters. Supplements work best alongside the fundamentals: reducing sodium, gentle regular movement, managing stress, protecting sleep. These are the foundation. Supplements fill the gaps and optimize your biology beyond what lifestyle alone can achieve. Quick recap. Number 5, potassium. Flushes excess sodium, relaxes vessels. Number 4, vitamin D. Suppresses renin-angiotensin system, supports endothelial health. Number 3, CoQ10. Cellular energy for vascular smooth muscle, critical for seniors on statins. Number 2, fish oil. Nitric oxide production, anti-inflammation, arterial flexibility. Number 1, magnesium glycinate. Natural calcium channel blocker, nitric oxide support, sodium-potassium balance, in the most bioavailable, senior-friendly form available. All 5 links are in the description, vetted for quality, purity, and clinical dosing. Please don't just grab whatever is cheapest. Quality genuinely matters with supplements, and the difference between a well-formulated product and a cheap one can be the difference between results and nothing. If this gave you value, drop a comment below. Which supplement are you most interested in starting with? Or have you already used any of them and seen results? Your experience helps other seniors watching this feel less alone in navigating these decisions. Subscribe if you haven't. Every week is another research-backed strategy specifically for seniors, and share this with someone managing blood pressure who's been told medication is their only option. They deserve to know there's more to the conversation. Next video, the 3 foods research consistently shows make blood pressure worse in seniors, including one that most people consider completely healthy. I'll see you there. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before adding supplements, especially if you have kidney disease, are on blood pressure medications, or take blood thinners.